name is Emily Glazer. I'm 21. I go to Texas Tech and I'm a senior.
My name is Mark and I am a senior at Texas Tech University.
There is a house built out of stone.
It all started when I was in high school. I was 13 and my parents told me that they were going to get a divorce. It was about 6 months that they kept telling my brother and I that they were going to get a divorce and then that they weren't going to get a divorce and everything was fine. They finally did get it and it was a rough divorce. And when I told my best friend, she didn't know how to handle it, and so she decided to stop hanging out with me, stop talking to me because she didn't know what to do for me. So I immediately thought that something was wrong with me, that even though the parents' divorce wasn't my fault, but driving my best friend away was my fault. And that's kind of where everything went into a downward spiral. My brother got very isolated, and it was very hard to reach out to him during that time that we were both hurting. And so I thought something was wrong with me. I didn't know really where to go or what to do, who to reach out to. And that's kind of when it all started, of like me getting depressed, me not wanting to hang out with people, me not really having motivation to do anything, and eventually becoming suicidal.
Depression began many years before starting Tech, and it was well controlled. However, when I came to Texas Tech, I had a hard time transitioning, especially being so far from home. Kind of spiraled out of control with my depression and anxiety. Ended up having to drop the semester, withdraw from all 5 classes.
By the cracks of his skin, I climbed to the top.
One thing that really led to my depression and anxiety is my sexual identity. I do identify as a gay male. And so that was kind of hard coming to Tech and having to deal with that, especially since I had just come out. I was afraid of the bullying that happens in middle school and high school. So that was a secret that I had to keep. And it was like wearing a mask. You're having to pretend to be this person that you're not every day. And that was even the case in front of my family, in front of friends, and in front of the world. The only time I got to be myself was when I was alone. And it was, I had still decided to hold the secret in until I came to Texas Tech. And so I began using substances in place of that feeling of trying to numb it, and used prescription pills to cope with that. And finally, I got to Tech, and my use had gotten worse. And that's when things spiraled. It was middle of September, and I took a little more than I should have, and I ended up passing out.
I'm Dr. Jane Westmoreland. I'm a staff psychologist here at the Student Counseling Center at Texas Tech University. First and foremost, I have a passion for what I do. I love working with college students in this unique and special time as they launch themselves into life. Coming from their families of origin and discovering who they are and what they want to do. And I'm so passionate about just working with college students, and that's what really motivates me to come to work every day. It's such a privilege and an honor to walk alongside clients in their journey, and to see the growth that happens in my office. That is such an honor. So there are a variety of concerns that bring students into counseling, and no problem is too small for someone to come in and seek services here. We really see a variety of presenting concerns, and anything from students who are adjusting to college, depression, anxiety, specifically test anxiety, things of that nature. We also deal with family concerns, trauma, alcohol and drug use, really anything that a student feels is distressing for them, or they're kind of having trouble coping with. That's something that we will work with here. So there are lots of benefits for students utilizing counseling. College is a great time to explore yourself and kind of reach your potential, set goals for yourself. If you're not happy with your current situation, to come to a safe and confidential, supportive environment and talk through some issues that you feel like you want to work through, and to have someone kind of guide you along in that process. Here at the Counseling Center, we offer individual, couples, and group therapy. If a student is interested in establishing services here, they would need to just come to the walk-in clinic Monday through Friday from 12:30 to 3:30. Students can come in, fill out some paperwork, and meet with a counselor immediately thereafter. At that time, we kind of determine what services would be best for the student and kind of take it from there.
I dealt with being suicidal not well. It didn't go well because it lasted about 2 years before I could actually get out of it. And how I got out of it was thinking about my brother. Every time that I attempted, I just thought about him and how much I loved him and how much I cared for him and how much I didn't want to lose him. And hopefully he didn't want to lose me either. And so just thinking about him and thinking about the relationship that we had together and all of us wanting to hang out just stopped me every time. Going to the counseling center and talking through all the dramatic experiences that I've gone through and what they have affected me to do today has been really helpful. I went in and I didn't really know where to start. I told my counselor that my mind was racing and I didn't know how to pinpoint what was my exact anxiety or worry on a subject. And so they really helped me figure out where my anxiety was coming from and how to deal with it, what I could actually manage and what I can't manage. They really helped me figure out, I guess, things that they helped me figure out what was something in my life that was helping me and what wasn't helping me.
I do have a doctor at the Student Wellness Center that I see on a regular basis, and she recommended going upstairs to the Student Counseling Center and meeting with one of the doctors and kind of going from there. So I scheduled an appointment with the counselors upstairs, and they did an intake. And the part of the intake process is to fit you with the doctor that works the best with your issues. And I was fortunate to receive a doctor who does well with prescription medication abuse and anxiety and depression. I feel happy about life, full of energy, love life to the fullest now. And I've never been adventurous, but I've been out rock climbing and hiking, and never played sports, and I've been playing sports and working out and eating healthy, and I feel great now.
So my advice to other students that may be depressed, anxious, even suicidal, anything like that, is reach out to someone, reach out to even one or two friends that you know are going to be there for you, and even family members if family is closer to you than friends, because family's not going to run away from you. They want you to be better. They want you to be around because they love you. And just don't be afraid to reach out to anyone and reach out for those resources, because there's a reason that you're here. And why end that too fast?
The Student Counseling Center is located in the Student Wellness Center building, and it's on the corner of Flint and Main. We're located on the second floor, so all you have to do is just take the stairs up, and we're located in room 201, and we're open 8 to 5 Monday through Friday.